Cardiac screening in sports medicine has always been a hot topic. With COVID-19 being prevalent in the area, it becomes even a hotter topic. My name is Dr. Matthew Pyle with Salina Regional Orthopedics and Sports Medicine.
Dr. Pyle, thank you so much for being on the show. Well, 2020 has been a unique challenge for all of us. I wanted to have you on to kind of talk about the challenges you've had with COVID-19 in your role as a sports medicine physician and along with the athletic trainers at the school. Can you share?
Sure, yeah, I agree with you. It's been a roller coaster of a year from all realms of medicine, and I think sports medicine sometimes gets overlooked in that COVID-19 realm, but as everybody knows, it kind of can affect everybody of all ages of life. And so one of the big processes that we're starting is to how do we get athletes back from COVID-19 safely back into sports, and that's kind of where we're starting to ramp up efforts here in Salina.
You started to talk about the getting the athletes back. So you've had some athletes that have tested positive. Sure. and have had COVID-19. So what happens next?
After they become positive, then the schools have in play some protocols to basically isolate them for a period of time. Once they've kind of been isolated and they become asymptomatic and are let out of quarantine, then usually they're required to have a follow-up with the provider, and then that provider basically will start the return to play progression with them. And it's pretty standard across the board now, and it's based on expert opinion because we just don't know how to get people back safely from an evidence standpoint at this point.
What are you looking for with them?
We kind of risk stratify them. It's based on how symptomatic they were, and then also based on underlying medical conditions. So someone who has, a chronic medical condition that takes medicines for something, they're going to require a little bit more close monitoring. And what we're really trying to rule out is cardiac disease, because they think that the virus maybe affects the cardiac muscle more than other viruses in the past have.
So outside of COVID-19, let's talk about a little bit of your role as the sports medicine physician for the athletes.
Yeah, so outside of COVID, I work sidelines with the athletic trainers, but I usually allow them to kind of manage things from a sideline perspective, and they take them through their scope of practice. And if they get to a point where they can't get them back into the sport that they're trying to, then I feel like that's my role, is to come in and maybe add to some of the things they've been trying. And then I work in conjunction with Dr. Hawks, the orthopedic surgeon, and Dr. Rump, orthopedic surgeon. And if we fail conservative management from my standpoint, then we have kind of ruled out everything else, and surgery may be warranted at that point.
Well, knee sprains and ankle injuries aren't great, but we hope we can go back to just that in the future.
Yeah, I agree.
Thank you so much for being on the show.
You bet.
Thank you for watching. For more information, please visit SalinaRegionalSportsMedicine.com. Like them on Facebook, follow them on Instagram and Twitter.